Hello. Hello. Welcome to today's session. This is part 2 of Yoga for Diabetes. Please come up to standing. Keep your feet together. Inhale from your nose. Exhale from your nose. Repeat once more. Inhale. Exhale. Feel relaxed. Now inhale from your nose. Exhale from your mouth. Once more. Next we'll be chanting Omkara. We chant once, take a deep inhalation, and then say the sound, feel it vibrate in your stomach, the sound in your chest, and the sound in your throat area. And are the 3 syllables of Om. Let's start. Inhale. And release. Now, please come to the front of your mat. And we'll be starting with Surya Namaskar. Join me at the front of your mat, your feet together. Today we're going over all the Yogasanas which are good for diabetes. So diabetes, as I mentioned, is a lifestyle disease and we have to manage the blood sugar levels well. So all the asanas which improve your blood circulation and target the abdominal organs. So the liver is situated on the right and we'll be doing side bends as well. Now, a word of caution, Surya Namaskar is not good for people who suffer from hypertension. That's the caution, heart disease and hypertension. Now, please start. Hands together. Extend the arms forward. Take your arms over your head. Inhale as you bend back. And maintaining that stretch in the upper body, bend forward, reach down. This is the hands to feet position. If your hands are only till the ankles or the shin, that's fine. If you can touch the floor, please try to do that. It's also allowed to bend your knees. You may also bend your knees to keep your fingertips on the floor. Those who can keep the knees straight, please do so. Exhale here, face to the knees. This is Padahastasana. Now look forward. And now you'll be bending your knees and taking your right leg back. Inhale. This is Ashwa Sanchalanasana. So for the first round, you can drop your knee on the mat, chin up. Now take the left leg back and go into inverted V. Walk your feet a little forward so that both your feet are flat on the floor. Crown of the head towards the floor, stomach tucked in, face towards the knees. This is the downward dog, inverted V. Exhale here. Now lower yourself in plank. Body weight shifts towards the hands. Eyes look forward. This is Dandasana plank. Inhale here. Now drop your knees on the mat. Take your buttocks slightly back. Bend elbows towards the floor. And gently bring your chin down between your hands. Exhale, hold. Sakshat Pranam. 8 body parts on the floor. Now inhale and come up into Bhujanga. Keep your elbows close to your ribs. Look up. This is the serpent position. Bhujanga. Inhale. Now from here, please curl your toes and lift up into inverted V again. Exhale. Look forward. Right leg forward. Inhale. Chin up. Left leg forward. Face to the knees. Exhale. Relax your knees. Come up. Inhale as you stretch back. And release. Repeat. Left leg. 1. Inhale. Hasuttanasana. 2. Padahastasana. Exhale. Bend knees, look forward. Left leg back. 3. Horse position. Ashwa Sanchalanasana. Knee should be directly above the ankle. 4. Inverted V or the downward dog. Pull your abdomen in. The squeezing action of pulling the abdomen in is very good for abdominal organs. Now plank. Inhale. Core is engaged. Knees down. Buttocks back. Chin on the mat. Exhale. Hold. Pelvis is lifted up. Now come into Bhujanga. Anterior body stretch. Very good for abdominal organs. Therefore good for diabetes. Chin up. Feel the stretch. This is one of the poses good for diabetes. Curl toes, inverted V, exhale. Now left leg forward, inhale, horse position. Right leg forward, knee straight, head down, exhale. Take your arms over your head, inhale and stretch back and release. So this is the 12-step Surya Namaskar. We'll be doing it once more with just instructions for inhaling and exhaling. Let's start. 1, inhale. 2, exhale. 3, right leg, inhale. Option is to keep the knee on the floor if you feel it's stressful to keep off the floor. 4, exhale. 5, plank, inhale. 6, exhale, hold. 7, inhale. 8, exhale. 9, inhale. 10, exhale. 11, inhale. 12, Samasthiti. Repeat left leg. 1, 2, exhale. 3, left leg, inhale. Knees on the mat. 4, exhale. 5, inhale. 6, exhale. 7, inhale. 8, exhale. 9, inhale. 10, exhale. 11, inhale. 12, exhale. And release. So this was the 12-step Surya Namaskar. Now we'll be going forward with some side bends. So you can place your feet on the edges of the mat. So this is a slightly more than hip width apart, the stance. And bring your arms to the side. So I like to show the sideways. So I have the slightly more than hip width apart stance, arms to the side. Now we're doing a side bend, Trikonasana, but we're just simply bending sideways without turning the feet. So please join me, bend to the side. Side bends are very good for diabetes because you're alternatively stretching and contracting the sides. So right now I'm bending to the left, so I'm stretching the right side of my body. Contractions to the left, come back up with an inhalation, bend to the other side, exhalation. It's a lateral bend, so your face should be in the line of your torso. Your face should not be forward like this. It should be just within the body. Come back up with an inhalation. Repeat 2 more times. Exhale side, look up. Come back, inhale. Bend to the side. Exhale, look up. Come back, inhale. Repeat once more. Exhale. Inhale. Exhale. Inhale. Now lower the arms down. Next we'll be going for a wider stance. So we'd like you to take your feet somewhere out. Now the stance between the feet is about 2.5 to 3 feet. Turn your left toes towards the front of your mat and your right toes in at 30 degrees. So left toes are fully out at 90 degrees and right toes are in at 30 degrees. Alignment is left heel to the right arch of your foot. Bring the arms to the side. You'll be repeating the Trikonasana. The only difference is the stance is wider. So this time when you bend, you'll be going down further. Your hand may touch the shin or the ankle. Join me. Inhale. Open the chest. Widen the arms. Stretch the arms away from each other. And as you exhale, please bend to the side. Bring your left hand on your left shin or the left ankle or on the floor behind you. And bring the right arm up and look up. 1, 2, 3, 4, 5, 6. Soften this knee. This is good for the safety of the knee joint to bend this knee slightly while coming up. And now lower the legs, lower the arms and repeat on the other side. Now I'm turning my right toes fully out and my left toes are in at 30 degrees this time. Alignment is right heel to the left arch of the foot. Arms to the side. Allow the shoulders to expand by pulling the arms away from each other. Take a deep inhalation and bend to the side. Keep your hand on the shin, the ankle, or on the floor behind you. And take the left arm up. Look up at the left fingers. Hold the pose. 1, 2, 3, 4, 5, 6, 7, 8. Slowly you'll be coming out of it. Please soften your knee. Come back up. Lower the arms down and release the pose. Turn your upper body and the pelvis forward and step back. Finish a couple of breathing cycles. When you're just relaxing, you can just shuffle your feet. So this is a side bend that we did, and it's very good for diabetes. So the cells which produce insulin are triggered and more insulin is produced, and that's what helps with diabetes. So side poses target the pancreas as well as the liver and the other abdominal organs. Now we'll be doing another interesting pose to the side. It's a kneeling position. Please kneel down on your mat. Place your knees as well as your feet about hip distance apart from each other. This is again a side bend in a kneeling position. It's called Yogasans. It's one of my favorite stretches called the gate lock pose. So now bring your left foot out and keep the toes pointing forward. So you're balanced on your right knee and the left foot at this point. Arms to the side, the same way. Expand the shoulders sideways. 1, 2, 3, 4. Now you'll be bending your upper body to the left at an exhalation. Please bend left. Bring your hand towards the ankle or the shin. And now the right arm can either stay here so that both the arms are in one straight line, or you can bring the right arm over your head, keep it over the right ear, look up. 1, 2, this is a firm gate lock pose, Parigasana. You'll often find such gates at farm entrances with a cross beam. 5, 6. If you want to go deeper into the stretch, you'll have to bring your right arm some more down. 7, 8, 9, 10. Come back up with an inhalation and release the pose. Repeat on the other side. So now you assemble the pose on the right. So please take your right foot out. Turn, keep the right toes pointing forward. So your face and your right toes are pointing in one direction. Arms to the side. Big inhalation. Stretch the arms and chest. Bend to the right this time. Keep on bending. Reach for your shin or the ankle. And then get your left arm over your head. Go to the maximum position. Final stage, look up. Breathe. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Come back up with an inhalation. And release. Now you can just relax. You can sit in Sukhasana or in Vajrasana. Sukhasana is to simply cross your legs. So we have looked at 3 standing poses. One was the Trikonasana with a very small stance where your feet were only a little more than hip width apart and you were bending. The second one was the Purna Trikonasana, which was a wider stance. And the third one we did is Parikasana. So I'm sure you can find one pose out of these 3 which suits you, or all 3 or 2. So you can please practice it. Next we go for sitting postures. So what I've planned today is Vakrasana. It's a very simple twist. Please sit with your legs extended. Shake out your knees. And fold your right knee. Now the right foot is kept near the left calf. I'm mirroring you, so my left is your right. Please sit upright. And take your left arm up towards the ceiling. Stretch. 1, 2, 3, 4. Now the left side is fully stretched. Maintaining that stretch, take your left arm on the outside of the right leg like this. Now when we keep the arm on the outside, the knee has a tendency to flop in. Please push the knee outward. So in turn, your left shoulder gets squeezed forward. Then you keep your free right hand on the floor behind your back with your palm flat on the floor and twist and look over your right shoulder. Maintain the pose. 1, 2, 3, 4. This is Vakrasana. It's a spinal twist. It's also twisting your midsection. therefore good for diabetes. 5, 6, 7, 8. Now a point of caution here. My left foot is not flopping. I've kept it upright. Kneecap is still facing the ceiling. Toes are pointing towards my face. Now we release the pose. Come back out of it. Very important to go into the pose with perfection and come out with perfection. Now we've switched. The right leg is extended, left knee is bent, left kneecap is towards the ceiling. Inhale and get your right arm up, stretch towards the ceiling. 1, 2, 3, 4. Now you'll be maintaining the stretch and taking this arm on the outside. Push the knee out, right shoulder gets squeezed, turn the upper body, left hand on the floor behind you, palm flat on the floor near your tailbone, and you look over your left shoulder. Breathe as you hold the pose. And slowly and gently return. Come back up and release your arm and release the legs. So there's another sitting twist which is good for you. It's called Ardha Matsyendrasana. We have done that. We've covered that in the other part. Now we will be folding the legs and going for Balasana. So you can keep your feet slightly apart and bring the knees together. Inhale and take your arms up. Stretch towards the ceiling. As you exhale, go into this deep forward bend. This is a child pose. Come back up with an inhalation. Stretch towards the ceiling. Go down. Exhale. Come back up. Inhale. So it's targeting the midsection. Reach down. Exhale. Now you are required to relax your forehead towards the floor and bring your arms by your side and keep the hands facing the ceiling, elbows slightly bent and head down. Relax. This is the final position of the child pose. Very nice stretch for the back and a contraction for the stomach. And slowly come out of it. Reach up towards the ceiling and lower your arms down. Now, if this position of sitting in Vajrasana and then going to Balasana was difficult, you could also try coming into it this way. So from the cat stretch position, you simply sit back and lower the head down. Try this. Come into the box position. Hands are directly under the shoulders. Knees are directly under the hip joint. Sit back. Exhale. Head down. Come back up. Inhale. Some of you may find this easier. Sit back. Exhale. Come back up. Inhale. Benefits are the same. You're stretching your lower back and the entire back, and as well as shoulders and arms. If you push your hands some more forward, you get a very nice stretch in your sides as well as your arms. And come back. Inhale. Now you can release. So the next position is we'll be doing 2 supine positions for diabetes. So please join me. We will be going into Baddha Konasana. I like to show it here. First, you sit with your legs folded. Bring the feet, soles of the feet together. This is a butterfly pose. So you can flap your knees slightly. Keep your back straight. And you can bend forward in this position by placing your elbows on your thighs and then bringing your face towards the feet. However, do not bend forward if you've just had a meal, and pregnant women should not bend forward after a meal after the 4th month of pregnancy because it gives too much pressure on the abdomen for that reason. Others can please bend forward. So very nice hip opener as well. Now, this is the Baddha Konasana as I said. You can try the Supta Baddha Konasana. So in that case, you're supposed to lie down on your back while keeping your feet like this. So let's try this. I'll be turning. So I'll release the pose for a moment and I'll be turning this way. You can either join the feet and then lie down, or you can just lie down first, like how I'm showing, and then bring the feet into the Baddha Konasana position. Now the soles of my feet are joined together and I'm placing them down. I'm bringing my heels as close to my body as possible. You can place your hands on your thighs. That helps to push the knees towards the floor. This is a restorative position. It's very good for diabetes. Also good for the lower back. You may keep your hands by your side on the floor and continue to be in this position for a while. If you're not able to relax in this pose, you can place cushions or bolsters below your knees, or the modification that I'm giving you is to be in the half cobbler position. So now what I've done is I have kept my right leg folded, my right foot is flat on the floor and the left foot is next to it like this. So the side of the left foot, the sole of the left foot is touching the side of the right. I repeat again, the sole of my left foot is now touching the inside of my right foot, inside edge of my right foot. My left knee and thigh is resting on the floor. My right kneecap is towards the ceiling. This is the half cobbler. 1, 2, 3, 4. This is for those people who cannot do the full cobbler position. Please shift and switch. Now, my right thigh knee is resting on the floor. My right sole of the foot is touching the inside edge of my left foot. And I'm relaxing on the floor. This is a very nice modification. Feel relaxed. Most of the diseases happen due to stress. So de-stressing is very important and we have to train the mind to relax. And slowly and gently bring your awareness back and bring your feet flat on the floor, kneecaps towards the ceiling, and just relax. You can extend your legs out. Now we'll be coming out of the lying down position. So you may fold your knees. Bring your arms by the side. Inhale and take your right arm over your head. Roll to your right. Push the floor with both your hands and come up to sitting. Now the Shavasana is a very good resting position for any disorders in the body because it improves your circulation, brings the heart rate down, brings the blood pressure down, So just relaxing on your back is a very good thing to do. And you can also relax with meditating, which is what we'll be doing now. So you can please bring your hands to your sides and go into this mudra where you fold the middle finger into your palm and place your thumb on the first or the second digit of the middle finger. Keep the other fingers straight and turn the palms towards the ceiling. Keep your back upright, shoulders directly above the sitting bones, ears directly above the shoulders. Your back is straight, eyes are closed. Focus on your in breath and your out breath. The breath is a very good tool to lead the body towards meditation. Chanting of a mantra or a syllable is also a very good tool to lead you to meditation. We are focusing on the breath here. Please breathe in and breathe out. Feel relaxed. Welcome your incoming breath. Welcome your outgoing breath. Be aware of each in-breath and each out-breath. With full awareness, breathe in. With full awareness, breathe out. Do not force your breathing, simply watch. And slowly bring your awareness back. You may gently open your eyes. And now we'll be doing a pranayama, which is good for diabetes. So we'll be targeting the abdominal area. So this pranayama is called Bahaya Pranayama. First, you'll be inhaling. Join me, please inhale. And then you exhale. Hold your breath. Again, inhale. 1, 2. Exhale 2. And pause for 2. Again, inhale. Exhale. Pause. Inhale. Exhale. Pause. Inhale. Now exhale. And in the pause, you take your chin towards the neck. At the same time, pull the stomach in and pull the perineum upwards. When you want to inhale, simply release the neck and inhale. Repeat. Exhale immediately. Chin to the neck, stomach pulled in, perineum pulled upwards. And release when you want to inhale. Deep inhalation, long exhalation. Pause and engage the chin lock. This is called Jalandhara Bandha. Pull the stomach in. This is called Uddiyana Bandha. Pull the perineum upwards. It's called Mula Bandha. Relax, release the neck. Inhale, exhale, and repeat this once more. Jalandhar Bandha, Uddiyana Bandha, Mula Bandha. And release. So this is a very good pranayama to do for all the organs in the abdominal area. So it works on not only your kidneys and your liver, also the pancreas, but it also works on your intestines and your reproductive and excretory system. Close your eyes. Allow your body to absorb the benefits of this pranayama. And now bring your awareness back and release your hands from the Shunya Mudra. Bring them together. Rub your palms together. And place your palms on your eyes. So resting and relaxing the eyes is very much a part of managing your blood sugar, because the eyes can get affected. And it's also a good idea to keep your fingers and toes moving throughout the day to keep your circulation going. So that's the final tip from me before I sign off. Thank you so much for joining today's session. I hope you enjoyed it and found it relaxing, as well as learning about diabetes. Thank you so much.